Hey you guys, welcome back to the channel. Today I have an amazing guest, a good friend of mine, Max Park. So we work together, we're both therapists. I'm a licensed clinical social worker and you're a
marriage and family therapist.
Marriage and family therapist. So I wanted to have Max on our channel because he is an expert in attachment. And when we do therapy, we always look at attachment and try to see what's there. Maybe you guys watching this have heard of attachment disorders, but you're not quite sure what it is. So today we really hope to answer those types of questions, and we definitely have an expert here to talk about attachment. So let's first throw out that question. How would you define what is attachment? Just attachment in general.
Yes. So attachment, if we want to think of it as a continuum, we are all on that line of attachment continuum. Whether attachment, how attached are we to the significant people in our lives, or how unattached we are to them. So think of that continuum, think of the bell-shaped curve. Most of us lie in the middle, and where we are attached, we're able to have and form attachments with significant others, our parents, usually, and this is where it all begins as well, is with our parents. And it usually starts in utero, even, or at birth.
So attachment, and tell me if this is right, it's about how well we attach or connect to people that are around us. And
right.
First starting with our parents then.
Right. And so as adults, those who have attachment issues, or if you're wondering about attachment, then it's if you have a difficult time connecting to your significant other, or you continue to have failed relationships, or people not being able to connect in this way, then you probably have some types of attachment issues.
And when you say you have a difficult time attaching to a significant other,
yes,
what might that look like? Like, what have you seen in your practice where people have come in and it's like, this just isn't working out, why is this so hard?
Yeah.
What does that look like?
Yeah, for example, recently I had a gentleman come in and was considering getting a divorce because he doesn't feel really connected to his wife, doesn't really feel loved from her, and doesn't feel a lot of love for her. And so that's kind of a typical scenario that might display itself. Or a woman who's unable to form any significant relationship because she always had the first date and never more than a first date. And because there's either something about her that she feels that I'm not able to trust, or I'm not able to put myself out there or be real, because that's a lot of it as well. Usually attachment issues and attachment disorder really comes down to trust. So if there's issues of trust, there's probably attachment issues as well.
Okay, so I think we understand what attachment is, and so when someone hears attachment disorder, it sounds like that means that they're not able to connect or attach. Relationships maybe are withdrawn, not connected, and it sounds like there's a trust issue that develops somewhere along the way that caused that person to detach or not learn that fundamental piece of trust. Is that right?
Correct. And so it could have a variety of issues that could have occurred to create either attachment issues or attachment disorder. And so when I was talking about that continuum, we're clear out that at the one end is attachment disorder, then attachment issues, then normal, and then we look toward enmeshment at the other end of the continuum.
I see.
Does that make sense?
Yes. And so attachment disorders, is it fair to say then that these occur in a certain stage of development, from being born up till you're 12 or till you're 18? What might that look like?
So, a very good question. And it usually, what they've said, it usually occurs in the first 0 to 5 years of life. What I've noticed that more like 0 to 3, where you have more disorders, up to 5 tend to be more attachment issues. And so what happens is that there's significant trauma of some sort in those first primary significant years of life. And so, and like I said initially, it can start in utero. And so think of mothers who are taking drugs or are smoking during pregnancy or drinking alcohol. Sometimes we have other disorders that are related to that, but there's still attachment issues as well. So fetal alcohol, many of the symptoms of fetal alcohol are also significant, same issues as attachment disorder. So it can happen in utero, like I said. So if they're taking drugs, alcohol, smoking, any of those things, or even had trauma such as physical abuse or domestic violence, that can affect the fetus in the womb, the baby in the womb.
I see. And I would imagine hearing this, and for those of you that are watching, you may have that question of, I'm a parent, I have children, maybe 10, 12-year-old, whatever, and you're wondering what significant things may have happened in that first 5 years, and you may be thinking, does my child have an attachment disorder because maybe they have a hard time connecting with friends, or maybe there's some behavioral stuff at school. What kind of things would you say may be indicators that there was something significant from 0 to 5 that people could be aware of or look for and say, perhaps my child does have an attachment disorder due to a significant event? I think maybe divorce, could that be a trigger for trauma?
Yes, but I need to say at the same time, one child in the family might be traumatized by a divorce, whereas another child, a sibling, may not be traumatized by that. So trauma is really individualized in how they interpret their world. And when you think of in utero or before birth, it really comes down to how am I going to survive? And if there's been inconsistent caregiving or meeting those essential needs like food, comfort, security, then that's going to be much more traumatizing, especially if whether it's inconsistent or they didn't get those needs met. So answering your initial question about what behaviors would we be looking at and symptoms, whether there's attachment problems, is the inability to, maybe their children are inability to connect with other kids in play. No kid wants to be around them. They don't want to be associated with them. They tend to be very, very, or could be very, very controlling, almost a bullyish kind of way. It could be that you kind of want to look at the filter of control. Typically, and there's different types of attachment, but one of the major ones and the easiest one to identify is where they tend to be very controlling of their situation, where they have to always be in charge. They're unable to share. They're unable to give and take. They're unable to allow others to be an authority over them even, but they use that filter of control. How controlling are they? If they're highly controlling, then there's probably attachment issues as well.
So if a parent is watching this and they're seeing some of these symptoms in their child, what is it that you would recommend that they do as far as, and I know that's a big question as far as treatment, but acknowledgement, how would parents work with that, seeing that their child not connecting, not having meaningful relationships, having all that need to control, because I think parents would then try to control more and in consequence perhaps to gain control, and is that really working against an attachment disorder?
Well, yes and no. They need to be treated, obviously, and attachment issues are treated much differently than just behavior disorders. And so I would suggest an assessment, getting an assessment done to find out how unattached they are, and as well as to find out, if you can look at their history and see that there was some trauma, like maybe there was spinal meningitis at birth or some other birth problems that may have caused. For myself, I also had pyloric stenosis in the first week of my life, and so I recognize some of the attachment issues that I have as well, and have worked on those because of being in the hospital, not having a caregiver being there. So
okay, when you have a client come in and there appears to be an attachment disorder from their experiences of life, their struggles to connect and to attach, and you're looking at 0 to 5, I would imagine that a lot of adults may not have much memory of traumas or things 0 to 5.
Mm-hmm.
So how do you address that? What's the approach?
Well, what I found is most adults actually do know. They don't have a memory, but they've been told by their mother, you had your lung collapsed right at birth, or you had the cord wrapped around your head, or you had pyloric stenosis, or you had spinal meningitis, or you had a number of birth disorders or trauma that occurred in those first 3 years of life or 5 years of life. Maybe almost drowning. So any kind of significant event, they might have memories from 3 on, or else they've been told by their parents different things that have occurred, or they can ask their parent, "What happened in my first 3 years of life? How was the pregnancy? What did you do for me while you? How did you live? Or what happened while you were pregnant with me?" So you can find out a lot of information that way if they don't know.
Okay. And generally speaking, when someone comes in and you identify an attachment disorder, what's that kind of look like as far as treatment with, how many sessions? Are we looking at 6 months? I know it's kind of a big question, but in your practice, what have you seen as far as to help someone work through that? And what does the treatment modality typically look like as well that you offer people?
Okay. Usually children, if parents notice it in children, the earlier the better, obviously.
Yeah.
They can get treatment, and I can teach them so many different wonderful skills that will really, really help them. And so it can go fairly fast. 1 year to 2 years maybe of therapy is all. I've even seen it less than that. But as they get older, it's more difficult because they get into patterns of control, for example, and it's more difficult. For adults, though, it tends to, teenagers are very, very difficult because they don't recognize that as an issue or a problem. But if they do recognize it, they actually can be healed and helped much quicker. So adults, when they recognize attachment issues, also are quick to get help and treatment and be able to heal and have healthy relationships.
And when you said you're able to, when you're meeting with a child, there's an attachment disorder, that's really good to get them in as soon as possible, and you can give them the skills. What would be some of those skills or resources you would recommend to parents for their child's treatment?
Well, a lot of it is working on that control piece of shifting the control balance back to the parents. If parents are very, very permissive, the attachment disorder child thinks that they are entitled. It's almost like they are the king, or the queen, and they control everything. And parents tend to get into that if they tend to be that style, of a more permissive style. And that's the worst thing that could happen. And because then they become very entitled, and they look very spoiled, and it makes it worse.
Okay.
So teaching parents how to parent is an effective way of helping them. So the way I treat with the parents. I do half the session, for example, an hour session, half the session is with the parents, giving them skills and help and answering their questions, and then the other half is with the child.
I see. So I imagine there's many types of attachment disorders, reactive attachment disorder and many others. Can you expound on these types of disorders, other ones, and what they are, what they would look like?
Right. There's what you can find online is styles of attachment, and we all fall into those categories. But when we get into actual attachment disorder, then there tends to be 3 types of attachment disorder. One tends to be very, like I already given examples of, tends to be more aggressive and more controlling and more kind of in your face. They will typically have symptoms of ODD, and so they're oppositionally defiant, very much so, and so those are called, the attachment disorder would be called disinhibited.
Disinhibited.
Yes.
Okay.
And then there's the other kind that tends to be more passive aggressive.
Okay.
They still tend to be controlling, but it's not seen and it's not easily recognized or even diagnosed a lot of times because it's kind of behind the scenes. All of a sudden you see the hamster dead, or you see, the garbage disposal broken, or the chair ripped up and cut, and clothes, and the child doesn't seem to know anything about it. So that tends to be the inhibited type. And then there's the disorganized type, which is the combination of both.
Disorganized is a combination of those first two.
Yeah.
Okay. So earlier you had mentioned that these people that have an attachment disorder, they have a hard time to connect. And I'm wondering what that may be like in relationship to like love. Tell me about that.
Right. So a lot of times you will see children with attachment disorder or adults, like I mentioned earlier, unable to connect or unable to love. And the truth is they really just don't understand love. They don't know what love is. They can see what love is. They know what affection looks like, and they can do it and they can mimic it, but there's not anything deep there. They don't have that deep connection. They're unable to connect. They don't really understand love. But they understand attention. They understand affection. But as far as real connection and getting deep connection with another person, they really, really lack that ability. So one of the things that I want to do with that child or adult is teaching them how to truly love another person and truly help them see through just the superficial and move to the deeper connecting types of love, and doing that through not just affection, but through respect, through obedience, service, understanding, empathy, and sacrifice. And I call those the 7 levels of love, and that I like to really work on each one of those and have objectives on each of those to help them really, really learn how to connect with another person.
And I think that goes back to why you're saying it's so important, if there is an attachment disorder, to get help really soon.
Correct.
Right?
Yeah. Because they really need, if they don't find that, then they will, what I've noticed with adults is they're in and out of marriages 5 or 6 times. There's just not something there consistent on a consistent basis for them. And they feel lost. They don't understand what it is about them or what's wrong. And at first they think it's always about this other person, but eventually they see, well, this is happening over and over again. And so the earlier, obviously, the better. The sooner they get into therapy, the better.
Great.
And the sooner they work on those issues. A lot of times, this attachment disorders is usually not diagnosed early, or it's misdiagnosed, meaning a lot of times it is diagnosed as fetal alcohol or ODD, oppositional defiant, or adjustment disorder, or conduct disorder. These are the same symptoms, and they're all very, very similar to reactive attachment disorder, but it's a much deeper problem if there's if there's trauma, and it reacts, or the child usually reacts much stronger than any of those other diagnoses.
Well, we really hope that through this video you better understand what attachment is, what attachment disorder is, the symptoms, the help that these people would need, what it would look like, and he's definitely an expert in this, more so than me. But very interesting to learn about. We hope that this video was informational and helpful. Please remember to like and subscribe. If you have any other questions, feel free to type them in the comments. We'll do the best we can to help you out in answering those. And we'll see you later.